Dr. Harris, what is the World Health Organization most concerned about at the moment when it looks at the pattern of coronavirus around the planet?
So our most greatest concern is that it's going now into regions with very weak health systems, where it's a struggle to even get the tests done, but also where you've got populations that have suffered enormously from other things, from conflict, from malnutrition, from concomitant diseases like HIV and tuberculosis. So we are watching Africa with great concern, but also South America and other parts of Asia.
And how is progress towards a vaccine going?
There's tremendous work, and as you may well have heard, some human trials have begun. But remember, these are human safety trials, and that requires quite a long period of study to ensure that not only do you not have short-term safety issues, but you need to ensure you don't have long-term safety issues. But there are over 100 vaccine candidates. In these few months, teams around the world are working incredibly hard to get those going. The other issue with vaccines is if we have a vaccine candidate, who does it go to and how does it get distributed? So last week, a lot of the nations and the manufacturers and the groups that work with vaccines like Gavi came together and agreed that we will have a coordinated process to do this.
The Australian government has called for an independent inquiry into the origins of coronavirus and its spread, and that would include looking at the WHO's role. What is your position on that?
So inquiries are always something that you do when you've had a cataclysmic event like this. For us, it's what you must do after every event. So even whether we've had a dengue outbreak in a particular country or yellow fever, we always do what's called an after-action review. And these need to be done independently. These need to be done in a way that allows everybody to have their say and have their say openly, not to be afraid of upsetting anybody else, really looking at the information, really looking at what we did well, what we didn't do well, and what we can do a great deal better.
And so the WHO itself would be happy to be investigated on that basis by an independent inquiry body?
So it's been a normal after many outbreaks and many things for WHO to be reviewed. I mean, after the big West African outbreak of 2014-16, there were actually 6 reviews, and they were really useful. We learned a lot. We completely redesigned our emergencies program. We went from being very risk averse to now really going in. Sometimes we're criticized for going in too quickly. But reviews are always helpful, especially if they're well structured and they're done in a spirit of improving things and improving health for all.
As you know, there's been criticism of the WHO from some quarters. What do you say to the suggestion that the WHO didn't sufficiently vet the information that was coming out of China in the early stages?
So we get information from all around the world, and it's always a struggle to get all the information we want. We're often struggling to get, say, clinical data. People ask us, what are the levels of illness in healthcare workers? We don't always get those numbers. So getting data from every country is a struggle. Finding ways to get better, more rapid, more transparent data from any country would be very useful.
Is there any merit to the suggestion that the WHO is too tight with China?
We have 194 member states. And in fact, it doesn't matter how big they are or how small they are, they all have an equal say. Sometimes each member state thinks they should have more of a say, but in fact, that's our constitution. That's how it was set up.
The US has withdrawn funding from the WHO for 60 days. It could possibly be permanent. That accounts for about 20% of your budget. What impact does that have?
It could have a significant impact on things like immunisation, polio programs, some of our emergency work. We've been looking at the areas. The United States has been a very generous, very supportive, fantastic partner. And because of that, some of the really important programs that affect the health of the world's children particularly could be impacted. But we're looking at how we continue our work, because our job is to maintain health for every person on this planet.
Dr. Harris, thanks for your time today.
That's a pleasure. Thank you.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.